Okay, let's just go.
If we go fast, less chance to turn off.
Yeah,
It's incentive.
Osteoporosis is a widespread disease that causes low bone mass, changes in bone microarchitecture, and a decline in the bone tissue. This leads to fractures, which has a tremendous cost to the economy. This presentation is going to explore the pathophysiology of osteoporosis, review the current treatments of osteoporosis, and the reason why there is a need for more effective treatments. In the search for more effective treatments, the novel drug romosozumab has shown promising results in efficacy and safety in contrast to our current treatments. There are two key cells that are called osteoblast and osteoclast. Osteoclast cells are responsible for the reabsorption of the bone, while osteoblasts form the bone. The balance of reabsorption and formation is an important factor for bone mass throughout life. This is shown in Figure 1. Osteoclasts become more dominant than osteoblasts, which means more bone is being reabsorbed than being formed, which ultimately leads to loss of bone mass. The current treatments aim at increasing bone mass and reducing bone reabsorption. The issue with this is they do not have any direct bone growing functions, thus do not drastically repair the microstructural inadequacy, which is the cause of bone weakness. In Table 1, it shows a comparison of the efficacy of the current drugs used to treat osteoporosis.
There are several important proteins in the bone remodeling process. These include WONT signaling, sclerostin, an inhibitor of WONT signaling, receptor activator of nuclear factor kappa B ligand, or RANK-L, which increases osteoclast activity, and osteoprogenitin, OPG, or inhibitor of RANK-L. Within the reabsorption phase of bone remodeling, sclerostin levels are increased and bind to WONT sites on LRP5 and 6 receptors on pre-osteoblast cells. This increases RANK-L production and decreases OPG, leading to bone reabsorption. Within the formation phase, the opposite occurs. Sclerostin levels decrease and WONT signaling increases. A decrease in RANK-L production and increase in OPG ultimately leads to bone formation. Romosozumab, belonging to a novel class of anti-osteoporosis treatment, has shown promising signs of being adept at uncoupling reabsorption and formation in animal and human clinical trials. As seen in Figure 2, romosozumab, a monoclonal antibody, binds to sclerostin, inhibiting its effects, increasing WONT signaling, causing decrease in RANK-L and increase in OPG production, leading to increase in overall osteoblast activity. Romosozumab is unique when compared to other treatments, such as teriparatide in Figure 3, which stimulates bone reabsorption and formation. Anti-reabsorption treatments such as bisphosphonate and denosumab, a RANK-L inhibitor, also lacks this mechanism, as they decrease bone formation and reabsorption. This unique antibiotic mechanism of action allows significant bone formation without stimulating reabsorption, showing superior efficacy and a good safety profile.
As shown in the table located in the poster, there have been a total of 5 clinical studies conducted on romosozumab. All 5 of these studies had the aim of comparing the effectiveness of this drug against its peers currently used in practice today. Randomization was used to allocate subjects to their respective groups to ensure no bias, and all studies had used control placebo groups as a baseline. Appropriate subject groups were selected through the use of a criteria, as postmenopausal women are more higher risk for developing osteoporosis. 4 of the studies had a focus on them. 2 of the studies had involved males. 1 of these studies had looked at the drug in males exclusively. All studies had required that the persons involved have a bone mass density T-score of -2 or below in one of the 3 required sites: neck, hip, or spine. All 5 of the studies had concluded that the drug had provided subjects with significant bone mass density increases, as shown by the graphics in the poster. These increases were shown to be of a greater effect than the current first-line medications, with a similar number of adverse events recorded. These researchers had credited this due to the romosozumab's dual ability to promote bone formation while simultaneously decreasing the reabsorption. In conclusion, after analysing the available evidence within clinical data, the efficacy has been shown to be superior to current treatment options. A limitation to the use of this drug is needed for more trials to assess the safety and efficacy of the drug, although if more trials are promising, then the use looks like a game changer. You can use that. I only studied
Yeah.
one.
You just want to like stop it, and do you just want to do a few